February, National Cancer Prevention Awareness Month. Cancer is obviously something that touches almost every single American. Here to discuss the ongoing research is the Chief Scientific Officer at the wellness company, Dr. Peter McCullough. Doc, before I get into this, I'm wearing a baseball cap today because I got a bandage on my forehead. I had a basal cell carcinoma removed this morning, and it was supposed to be just a scrape, and it ended up being like 12 stitches. So, yeah, this stuff is real. Tell us what you think we should be doing. Tell us what we're doing wrong, and what is the wellness company doing to help us?
Eric, first let me say that was a great interview you just had, and I'm with you. I think AI is going to be big. It's already big in medicine because the medical database is so huge. It's helping us find answers quickly, particularly at the bedside. I use it all the time. I think it's going to become even more powerful. It's going to make us better. Now, in terms of cancer, the big breakthroughs now are, thoughts that we can prevent cancer. So sure, surgery, chemotherapy, and radiation have gotten better, but to prevent cancer and prevent all of that expensive treatment and misery would really be the goal. So there's ways we can organize our lifestyles, our diet, in particular now some new products from the wellness company, including Shield, which is a combination soft gel drink system that will help patients raise their defenses to fight off incipient cancers.
So cancer causes continue to evolve. Do we know what some are? And Shield is a way to actually shield us from some of the toxins, carcinogens that we may be ingesting?
Right, and also help activate our tumor suppressor system. So it turns out you probably are forming little tumors, like you formed one in that basal cell carcinoma, Eric, and your body didn't have the ability to knock it out. And what Shield is doing is trying to raise those defense systems, clearly, detoxifying when we can. And, especially for some of the deeper cancers, Eric, pancreatic cancer, other solid organ cancers, they're not easily detected. Thank goodness your basal cell, you could see it and you got it removed. And hopefully the margins, everything are clear and you're done. But for internal organ cancers, I think we all need to improve our lifestyle diet. And I think many should be considering Shield.
Really important, Shield. And I guess this is how it plays in. Most of the focus, I guess, in big pharma and certainly big medicine as well, as treating cancer, right? Everyone's got a cancer hospital, but it's kind of a little too late then. But what about the focus on preventing cancer? What should we do?
Well, it's the way to go. First off, I would say never smoke. If you smoke, stop. Believe it or not, alcohol is a risk factor for head, neck, and esophageal gastric cancer. So for some, that's going to be tough to say goodbye. We know actually being too fat, too heavy, particularly in women, is related to some breast and gynecologic cancers. And we're into early screening and detection. So certainly mammography, colonoscopy, PSA, prostate, testicular exams for smokers, rapid CT of the lungs. And then beyond that, it's really down to anti-cancer diets. So we know cruciferous vegetables like kale and broccoli, turmeric, and then, of course, supplements like Shield that takes extracts, medicinal and culinary extracts, and really boosts our defense systems.
Dr. Pete, always good to have you on. I like next time we come on, we want to talk to about ivermectin, because you and I did a lot of work years ago, about 5-6 years ago during COVID, and they said we were crazy and you were crazy, and it turns out you were, they say conspiracy theories are only conspiracy in theory for so long, they end up being real. Doc, good to get you back, my friend. Talk to you again soon. Wellness Company, folks.
Thanks, Eric.